Now, for the laboratory diagnosis of anthrax infection, okay, our specimen of choice would be the malignant pustule coming from the infected person. Okay, pwede din tayong gumamit ng sputum. Or we can also make use of blood specimen. Now, for the gram stain of this bacteria, again, they appear to be as large, boxcar-shaped gram-positive cells. But sometimes, yung mga old cultures natin, they tend to appear as gram-variable cells. Okay, gram-variable cells. And then, they have this unstained area, unstained central area, representing now the spore. Okay, now, if you want to demonstrate this endospore, you can make use of special stains naman. Just like your Macfadyen stain and your malachite green. Now, this Macfadyen and your malachite green are used to stain the endospores. Now, for the culture media, what are the culture media that we can use for the isolation of your Bacillus species? Okay, so pwede tayong gumamit ng blood agar plate, chocolate agar plate, even your nutrient agar. We can also make use of phenylethyl alcohol agar, your polymyxin lysosome, talus acetate agar, bicarbonate agar, gelatin medium, and egg yolk agar. Okay? Now again, ang itsura ng anthracis natin, your Bacillus anthracis sa blood agar plate, they have this unique appearance of the colonies described as medusa head colonies. Medusa head colonies because of their swirling projections on blood agar plate. Then they are also non-hemolytic, non-hemolytic on BAP. Now, we have this what we call phenylethyl alcohol agar and your polymyxin lysosome and talus acetate agar. Itong agar na ito, ginagamit siya for the isolation of Bacillus species from heavily contaminated specimen. Heavily contaminated specimen. And then, we can also make use of bicarbonate agar. Bicarbonate agar, ginagamit yan to induce Bacillus anthracis capsule formation, to induce the capsule formation of your Bacillus anthracis. And then, we also have this gelatin medium. Para saan yung gelatin medium na yan? Okay? It is also used to isolate your Bacillus anthracis. And then, the growth of your Bacillus anthracis appears to be resembling like an inverted pine tree. Inverted pine tree appearance. Inverted pine tree appearance. It resembles like an inverted pine tree, indicating that this bacteria is positive for liquefaction. Okay. So, gelatin medium is actually based from the liquefaction of your bacteria. Okay, and then we have also lastly, your egg yolk agar. Yung egg yolk agar naman na yan, ginagamit din yan for your Bacillus anthracis or any bacteria that are lecithinase producers. Okay, so this is based on the presence of lecithinase produced by your organisms. Now, the colonies are described as opaque colonies sa egg yolk agar natin. Opaque colonies. Now, since our Bacillus anthracis is a lecithinase producer, tutubo siya sa egg yolk agar natin, producing now these opaque colonies. Now, I want you to remember, class, na every time that we are handling cultures, or let's say organisms na merong spore, it is always important to inactivate first their endospore. Always inactivate their endospore. Kasi, a while ago, when we are discussing your Bacillus anthracis, pwede yan makuha through inhalation lang. Diba? Pwede siyang makuha through inhalation. So, before we are going to perform plating, or bago natin i-culture yan sa culture media, inactivation of these spores is a must. Okay? Now, we have this what we call, technique, okay, we have this what we call technique, your alcohol shock technique. Your alcohol shock technique. Or sometimes, sa ibang libro, ang term nila is heat or alcohol shock technique. Heat or alcohol shock technique, ang pangit. Okay, heat or alcohol shock technique is used to inactivate this endospore. Okay. So, this technique is used to inactivate the endospore of your bacteria before subculturing it or before performing plating. Bago mo siya ilagay sa culture media. Now, this technique is also applicable to Clostridium species. Okay? So, please, wag niyong kakalimutan ito, your heat alcohol shock technique. So, actually, ilang beses na ata yan lumabas sa board exam, if I am not mistaken. And then next, we have your diagnostic test. Okay, for the diagnostic test of your Bacillus anthracis, we have this what we call a Scolai test. A Scolai test is a precipitin test. Okay, so serological method yan. It is based from formation of precipitin band. Okay, so this is actually a skin test. Skin test to detect thermostable anthrax antigen. Okay, so ginagamit siya to detect thermostable anthrax antigen. Okay? Now, for the procedure niyan, madali lang yan. You're just going to incubate your patient sample plus your reagent. Okay? Reagent, which is your acetic acid and then your anti-serum. Anti-serum. And then, after incubating it, okay, ang positive result niyan is the formation of precipitin band. Precipitin band formation within 15 minutes. Now, let us go over with your Bacillus cereus. Bacillus cereus. Bacillus cereus, also known as your fried rice bacillus. Okay, these are motile non-encapsulated organisms. Okay, motile yung mga yan. Non-encapsulated organisms. They are also spore-forming organisms. Spore-forming organisms. Their spore is also centrally located. Centrally located. Okay. So again, your Bacillus cereus, they are motile, non-encapsulated organisms. They are also spore-forming bacteria, centrally located. But if you want to differentiate it from your Bacillus anthracis, madali lang naman. Kasi ang itsura ng mga spores ng Bacillus cereus is said to be swollen. Okay, so swollen yung kanilang spores. Okay, kung idodrawing natin yan, ganito ang itsura ng kanilang appearance under the microscope. Okay, so square-ended pa rin, centrally located spore, tapos swollen. And then your Bacillus anthracis, ganyan, tapos ganyan. Okay, so madali lang ma-distinguish yung dalawa. Okay. Now, as we all know that your Bacillus cereus is the causative agent. Okay. Or rather, they are the most common causative agent of food poisoning. Okay? Your fried rice, Bacillus. Now, your Bacillus cereus, it is the most commonly encountered bacillus in causing opportunistic infections. Okay? So, your Bacillus cereus can be part of the normal flora of the GIT, but sometimes, pwede sila mag-cause ng opportunistic infections, okay? Specifically, food poisoning, due to contaminated rice and other food products. Now, these are said to be resistant to penicillin. As we said a while ago, pwede mong gamitin yung susceptibility test for penicillin to differentiate it from Bacillus anthracis. Okay? Now, when it comes to culture, in terms of the colonies, they appear as large, okay, large, feathery, spreading, and sometimes frosted glass colonies. Frosted glass colonies with beta hemolysis. Beta hemolysis in blood agar plate. Aside from blood agar plate, they can also grow in phenylethyl alcohol agar. Okay, so pwede rin silang tumubo sa phenylethyl alcohol agar natin. Also, for your Bacillus cereus, they are also considered as lecithinase producers and salicin fermenters. Now, the main virulence factor of your Bacillus cereus, okay, the main virulence factor of this bacteria is we have your enterotoxins. Enterotoxins, specifically your heat-stable enterotoxin and heat-labile enterotoxin. Aside from this one, they have this what we call cerealizin, and your phospholipase C. Phospholipase C. Now, take note, class, that in your Bacillus cereus associated with food poisoning, the best specimen for testing is the suspected food itself. Okay? So, ang best, or rather, our specimen of choice for testing is the food product suspected with the organism. Now, food poisoning associated with Bacillus cereus come in two forms. Okay, so may dalawang uri yan. We have the emetic type and the diarrheal type. Okay, emetic type is associated with the ingestion of improperly stored fried rice and reheated rice. Okay, so ang term natin doon, reheated rice. Okay, this is a form of food poisoning associated with ingestion of improperly stored fried rice and reheated rice. Now, your emetic type, it has a short incubation period. Usually, 1 to 6 hours pa lang. Sa loob ng 1 to 6 hours, pwede nang lumabas yung simptomas. Okay? 1 to 6 hours is the average duration of the illness. Okay? Signs and symptoms include abdominal cramps and profuse vomiting. Okay, kaya nga emetic type, pagsusuka. Okay, now, this emetic type, ang responsible dyan, okay, tawag dito, heat-stable enterotoxin, your heat-stable enterotoxin is responsible for causing now your emetic type food poisoning. Okay, so the main tawag dito, ang basta yon, your heat-stable enterotoxin is responsible for causing emetic type food poisoning. Okay, associated with your Bacillus cereus. And then we have your diarrheal type. Your diarrheal type is associated with ingestion of contaminated meat and poultry and other vegetable product. Okay? Now, this diarrheal type is usually manifested with abdominal pain and watery diarrhea without fever. Okay? Take note of that one, abdominal pain, watery diarrhea without fever. Now, the main responsible for causing this one is we have your heat-labile enterotoxin. And then lastly, we have your Bacillus subtilis, also known as your haze bacillus. Now, these Bacillus subtilis, they are said to be halophilic organisms. Okay? Halophilic organisms. Tapos, ang pinaka-importance niyan, okay, they are the one who are responsible for production of bacitracin. Okay? So, sa kanila nanggaling yan, your bacitracin antibiotic. Now, when it comes to culture, when it comes to their colony appearance, it is said to be large, flat, dull, and then sometimes we describe it as ground glass appearance. Ground glass appearance, and then some isolates may be beta hemolytic, while some are being non-hemolytic. And then some colonies are said to be pigmented also.